Welcome to MiSurgical. My name is Dr. Jeff Shad, here to give you a tour. Please come on in. We are here at the waiting room of MiSurgical, where the patients check in with our awesome front office receptionists and schedulers, wait for their treatment time. This side, we have our chiropractic and physical therapy department, where the patient receives their physical medicine and chiropractic care. Come on in. Here is a typical physical therapy or chiropractic care, a room where a patient receives their treatment on a daily or weekly basis. Here are our dynamic physical therapy room, where the patient performs certain exercises for the body part that was injured with the help of our amazing physical therapists and physical therapist assistants. Another sample of a typical physical therapy and chiropractic room, where the patient receives certain modalities such as ultrasound, electrical stimulation, Russian stimulation for rehabilitation of the injured body part. Here's our X-ray room or radiological room, where we perform X-ray images for the body parts that are in question, and we could diagnose you on spot. It's a digital X-ray. Not that many locations have it. We are proud to have our own in-house X-ray. Here's another treatment room with variety of modalities, ultrasound, and also in this room, we do review your MRI X-ray images to understand the condition that is causing your pain. In this room, we treat the patients with herniated disc in the neck or back. So if you have neck pain and back pain due to disc herniation, disc degeneration, injured disc, whether it's sports injury or gradual onset or a car accident or slip and fall, whatever the nature of your injury is, this device called DRX9000, commonly known as spinal decompression, non-surgical, could decompress your disc of lower back and the neck. So we have two components, and next to it, we do have a relaxing zero gravity massage chair we use prior to your treatment to relax your muscles, heat your muscles, then decompress your spine. This whole side is dedicated to chiropractic care and physical therapy. So let's go check out the medical group side. Welcome to MIMG, the medical group side. Come on in, let me show you around. Here's our provider room. Here we have Nazi Arefkia, our CEO, and Dr. Kevin Burns, our medical director. Here we have our medical consultation room, where orthopedic surgeons, neurosurgeons, pain management doctor, neurologist, general surgeon perform examination for our patients. Here's our administration room, where we do a lot of surgical scheduling. Here's Miss Kelly. She pretty much does all the initial scheduling for evaluation, consultation, authorization, and eventually surgical scheduling. This is a colorectal and general surgical evaluation room, where patients are seen for a lot of the GI or hemorrhoid and colorectal issues. This one is our orthopedic, neurological, and surgical evaluation room. All the patients with spinal injuries, extremity injuries for orthopedic and spinal evaluation, pain management are seen in these two rooms. This is another one of our examination room, where it's used by our orthopedic surgeon and our spine surgeon and myself, evaluating patients for spinal disorders. We're now on the surgical center side, where you come in, get checked in prior to your surgery with our wonderful surgical scheduler and a receptionist, Irma. She would provide the preoperative information and chart and go over your medical record and get you ready for pre-op. We're now going to look at behind the scene where your pre-op and post-op and surgery is going to happen. Come on in. This is one of the two preoperative areas where you get checked in prior to your surgery with our wonderful nurses. This is our second pre-op area where you get checked in prior to your surgery, and you get to meet one of our wonderful nurses, Jenna. And let's move on to the next section. This is our nurse station right by the post-op area, the recovery area, where our wonderful nurse, Amy, makes sure post-operatively everything is perfect before you get discharged after surgery. One person here that's a little shy, but she makes everything happen in the surgery center is Clarissa, our director of nursing. Love to introduce her. She's amazing. This is one of 2 operating rooms where all surgical procedures are done. The types of procedures done in these rooms are artificial disc replacement for your neck and back, joint replacement, pain management injection, colorectal surgery, plastic surgery, general surgery, hernia repair, all with the use of visually assisted equipment such as endoscope, laparoscope, microscope. With the use of fluoroscopic equipment, you're able to achieve the most minimally invasive surgical procedure for you with minimal damage to your body. This is our second surgical room, where, as I mentioned before, similar type of surgeries happen in this room as well. It's just for convenience for patients and surgeons.
Hi, I'm Dr. Tony Mork. A good diagnosis is the key to what I consider to be the ultimate in minimally invasive surgery, which is endoscopic spine surgery. A clear diagnosis is what allows you to get the minimum of surgery. Minimum of surgery, it's going to be the minimum of soft tissue disturbance. You're not going to disturb any tissues that aren't involved with the problem, and it also really significantly diminishes any chance of overuse of narcotics postoperatively. These incisions are 3/8 of an inch. The pain from the surgery is gone in 7 to 10 days, and the problem is well on its way to healing with the minimum of disturbance of the other tissues that aren't involved with the problem. And so pain medications in this day and age of opioid concern and abuse is something that really doesn't last for any length of time.
Hello, my name is Kevin Burns. I'm an interventional radiologist and I'm the medical director of the Minimally Invasive Medical Group. So my training is in interventional radiology, which is a medical specialty where we can perform procedures that traditionally required surgery using imaging guidance. So that means that we can have smaller incisions and less pain for patients. As an interventional radiologist, we perform a lot of procedures throughout the body. Our expertise is in using imaging, so we can perform procedures in multiple organs throughout the body without having to make incisions. We use X-ray, ultrasound, CT, and we can get places inside your body to treat conditions that traditionally required surgery.
Hello, I'm Dr. Jeff Shad. I've been using this amazing machine, DRX 9000, the spinal decompression, for over 24 years. I started it back in year 2000. I've seen possibly 1,000 surgical candidate patients who were told they need surgery, patients who were told they need injection, patients who were on chronic pain medication, patients who had no other choice left. This machine decompresses your spine and allows your spine to get its biomechanics back, meaning you're able to function, do your usual and customary duties, your activities without discomfort, without any pain medicine, and without any surgery. This is what decompression could do for you. We are here to help. Please reach out, call us. We could help you.
Hi, my name is Afzal Iqbal. I'm an anesthesiologist and pain medicine specialist at the MiSurgical Center. I specialize in injections and spinal cord stimulation, as well as side joint fusion, among other procedures to help with patients who are suffering from chronic pain. My background is primarily in anesthesiology. I did a residency at the University of Rochester and a fellowship at the same institution where I was chief resident. Prior to that, I went to medical school at SUNY Stony Brook in New York and did my undergraduate at Emory University with a major in neuroscience and behavior. If you have any questions, please reach out to us. We're always here for you anytime.
Hello, my name is Dr. Alireza Buzurgi. I'm a neurologist, pain specialist, and epileptologist. I did all of my training, including residency and fellowships in Cleveland, Ohio, where I also worked for a few years before joining MiSurgical here in California. A pain doctor works in conjunction with the other doctors, including neurologists, orthopedic surgeons, psychiatrists, rheumatologists, and also primary care physicians. Nowadays, with better understanding of pain and its treatments, we have a lot of remedies in our toolbox to understand and treat painful experiences. Thank you very much for watching this video. I hope that you learned about me and what I do and about MiSurgical. Please feel free to contact us with your questions and concerns. We are here to help you.
This unit is called DRX 9000, non-surgical spinal decompression. It's an equipment that we use for pain management. Patients who suffer with disc-related injuries, chronic degenerative disc disease, chronic joint disorders in the neck or back, you're able to decompress your spine non-surgically, allow the spinal fluid penetrate into the disc and revitalize your disc and take the herniated disc and in a way suck it back to the center where it belongs.
In my opinion, I think that annular tears are probably one of the most underrated and underdiagnosed problems causing people have chronic low back pain, as well as kind of their back going in and out over a period of months or years. Sometimes people will get the injection, the pain goes away almost immediately and never comes back, but this is a little bit more the unusual situation. In any event, it's not an epidural, it's actually an injection inside the disc. So most people don't really do this, and it can be very effective and a very easy and a conservative way with very low risk where people are getting fusions for this problem. Here's a simple to do injection with this kind of problem.
Thank you for watching this tour. I hope you learned a little bit more about MiSurgical and what we all do here. I just want you to know we are all here to help. Please reach out.